I never envisioned that settling in a picturesque neighborhood would embroil me in one of the most audacious power plays of my career, especially given my role as the state health commissioner. My name is Dr. Alina Royce. While my professional life is devoted to overseeing public health systems and hospital regulations, at home I yearn for an ordinary life. Quiet evenings on the porch, friendly weekend chats with neighbors. That's exactly what I thought I'd find at Brookhaven Heights, a suburban community with wide streets, manicured lawns, and a welcoming sign that read, "Where neighbors become friends." It comprised several hundred homes, plus a small commercial district that included an elementary school, a handful of shops, and, most notably, a modest community hospital called Brookhaven General. This hospital was a lifeline for the region's residents, especially for the elderly and those who struggled to travel to bigger facilities in the city. I purchased a charming colonial-style house nestled near a small grove of willow trees, relishing the idea of retreating from the frenetic demands of my job. My spouse, Marcus, shared my excitement, eager to live in a place that felt safe, neighborly, and reminiscent of the suburbs he grew up in. We didn't flaunt my position as state health commissioner. I wanted people to treat us as ordinary neighbors, not to fear or fuss about my role. At first, everything was serene. The next-door couple brought us a welcome basket. A group of children biked through the cul-de-sac at dusk. I took morning walks to admire the well-kept gardens. Sometimes, I'd pass the facade of Brookhaven General, a simple two-story hospital building with a small emergency department. My professional side quietly assessed its outer appearance. It looked well-maintained, though presumably not flush with funds. But in my private capacity, I was merely a neighbor, grateful that if a child or senior needed immediate care, help was just blocks away. Little did I suspect that the greatest threat to the hospital's existence would come not from budget shortfalls or medical staff shortages, but from an obstinate HOA official determined to clean up Brookhaven's image at any cost. Within a few weeks, the local homeowners association held its monthly meeting in the community clubhouse. Curious to learn more about the neighborhood, Marcus and I attended. We discovered that the HOA's usual topics were things like lawn regulations, mailbox uniformity, or scheduling block parties. People chatted amiably, except for one figure who sat at the head of the table, exuding an air of absolute control. She was in her early 50s with meticulously styled hair, wearing a crisp blazer in a stark shade of teal. Her name, officially, was Brenda Adcroft, though neighbors I'd met earlier warned me she was widely referred to as Karen. The story went that in previous controversies she'd overreacted, micromanaged, or attempted to ban seemingly harmless activities, all under the claim of protecting property values. She locked her gaze on every new attendee with a mixture of suspicion and condescension. When the meeting began, Karen dominated the conversation, rattling off a list of violations and concerns. She used words like unsightly elements and neighborhood standards. People listened patiently, though I sensed an undercurrent of resentment. Several times, board members tried to shift to lighter topics, like planning a summer barbecue. But Karen always snapped the discussion back to her complaints. Midway through, she started criticizing the presence of Brookhaven General Hospital. She claimed ambulance sirens disturbed the peace, that the hospital's older facade depressed property values, and that the traffic of sick people was an eyesore. My eyebrows shot up. I'd never heard someone so brazenly disparage a local hospital, especially one that was crucial for emergency care. Yet Karen sneered, "We need to reevaluate if having that facility right in our community is truly beneficial." A mild board member, Ms. Whitley, raised her hand. "But it saved lives. My husband had a stroke last year, and their swift care made all the difference." Others murmured agreement. But Karen waved them off, saying, "We can always drive to the big hospital in the city." Meanwhile, that old building tarnishes our image. I felt a surge of anger, but I held my tongue. She had no authority to close a hospital, or so I thought. Her words lodged in my mind, a red flag that something ominous might be brewing. I told Marcus afterward that this Karen was trouble incarnate. He patted my arm, saying, "Don't worry, it's probably just idle complaining." If only that had been true. Over the next month, I noticed Karen intensifying her rhetoric against the hospital. She circulated flyers claiming property values were 30% lower in areas with medical facilities. She pinned a graph on the community bulletin board, though I, as a data-savvy commissioner, could tell it was dubious. She launched complaints about hospital visitors parking on nearby streets, claiming it caused excessive traffic. At the same time, she attempted to stoke fear. What if infectious diseases spread from that hospital into our neighborhood? She had no medical credentials, but it didn't stop her from hinting that we were at risk of contamination. A few naive residents started repeating her talking points, though most recognized it as scaremongering. In my professional capacity, I oversaw licensing and oversight of hospitals statewide. However, Brookhaven General had always complied with regulations, passing inspections and serving the local population effectively. I had no cause to suspect it was in danger until I spotted Karen in the parking lot one day. She was chatting with a stern-faced man in a suit, gesturing at the hospital's exterior as if scolding it. I lingered at a distance, watching her vehement expressions. Something in my gut twisted. Was she seeking a lawyer or a real estate developer? The sense of foreboding grew. The next HOA meeting was chaos. Karen introduced a motion, establish a petition to request the immediate relocation or closure of Brookhaven General. Gasps swept the room. Ms. Whitley stood up, outraged. You can't do that. The hospital isn't under the HOA's authority. Many neighbors echoed that. But Karen insisted that with enough political pressure, we could force the city or county to reevaluate the hospital's permit. That's when I realized Karen might exploit bureaucratic loopholes, perhaps lobbying city officials, forging claims of building code violations. Despite my urge to reveal I was the state health commissioner and to scold her for playing with people's lives, I decided to remain quiet a bit longer to see how far she'd go. My job was to guard public health, but I wanted a clearer sense of her strategy first. Days later, rumors spread that Karen had traveled to the county zoning office. She allegedly claimed the hospital was out of compliance with certain building codes, referencing obscure sections that might never have been enforced. She also wrote letters to the city council, complaining about noise pollution from ambulances or how hospital trash disposal was endangering children. None of it matched the actual track record of Brookhaven General. But if there's one thing I knew from experience, it was that dogged complaints, even unfounded, could tie up a facility in endless red tape. Marcus, noticing my anxiety, asked why I didn't just reveal my position and shut this down. I explained that I typically tried to keep my professional roles separate from local neighbor disputes, respecting local governance. However, the moment was approaching where that might no longer be feasible. The hospital's administrators had no clue they had a potential champion living nearby. They were fighting a barrage of petty claims from some HOA official with unknown resources. If they didn't push back effectively, they risked incurring fines, or worse, forced closure pending reinspection. Then came the day we all dreaded. An official letter from the city planning department announced that Brookhaven General faced a temporary suspension of operating permits for alleged code breaches. The letter was posted on the hospital's entrance, shocking patients and staff. My phone blew up with frantic messages from neighbors. She's done it. Karen actually got them to shutter the hospital. People are being transferred out as we speak. I jumped in my car, racing to the hospital, heart pounding. Indeed, a line of ambulances stood outside, preparing to move patients to other facilities. Hospital staff, outraged and helpless, explained that they'd been blindsided by the sudden order. The city refused to reconsider unless all violations were resolved, which could take weeks. In the meantime, Brookhaven, our entire region, lost its primary emergency care center. And with it, countless lives were now at risk in a medical crisis. I stood by the hospital's driveway, watching a frightened mother ask a nurse where her child with pneumonia would be treated, tears shining in her eyes. The nurse apologized that they had to send the child to a larger hospital 40 minutes away. My fury at Karen reached a boiling point. This wasn't just about property values or petty politics. It was a dangerous assault on public health. Without further hesitation, I revealed my identity to the hospital's administrator, Dr. Lindstrom, explaining that I was the state health commissioner and that I had no idea the closure was imminent. Her eyes widened. "Why didn't you?" she started, then shook her head. "We're grateful you're here now. Please, we need help reversing this order." Yes, the city had authority over local building codes, but as commissioner, I wielded significant influence in licensing medical facilities. Also, our state had an emergency override for crucial healthcare infrastructure if we proved the closure threatened public safety. I texted an urgent message to my top aides at the state health department, instructing them to review Brookhaven General's file, compile its compliance records, and prepare for an immediate legal push to reopen it. Meanwhile, the hospital staff began transferring critical patients, lacking any choice. The city's order was non-negotiable until further notice. Angry, confused neighbors started gathering outside, demanding explanations. Some recognized me from my press conferences on public health, and word spread that the state health commissioner is one of us. People turned hopeful, imploring me to intervene. My phone rang off the hook with media inquiries as local journalists caught wind that a bizarre HOA campaign had shuttered a vital hospital. And Karen? She was nowhere to be seen, presumably savoring her victory. Or maybe she was laying low, aware that such a bold move would provoke a storm. That evening, I convened an emergency teleconference with key officials from the state. My staff was flabbergasted that a small HOA campaign had triggered a forced closure. The building code violations cited were trivial or outdated, but the city's planning board had invoked them under political pressure. The question was how Karen gained that political sway. Possibly she had connections with a city council member who disliked the hospital, or she simply bulldozed them with relentless complaints and threatened lawsuits, prompting them to err on the side of caution. I told my staff to expedite an official state inspection. Under state law, if the hospital was found structurally sound and operationally safe, we could override the city's suspension in the name of public necessity. The next step was to gather inspectors, medical experts, and attorneys to storm Brookhaven General, evaluate it swiftly, and file an emergency injunction if needed. Meanwhile, social media exploded with outrage. The local community posted heartfelt stories of how Brookhaven General saved their loved ones. The hashtag #SaveBrookhavenHospital trended regionally. People demanded that the city reverse this nonsense. The meltdown was reminiscent of some farcical scenario, except real lives were at stake. Karen's role gradually surfaced in these discussions. Some pointed to her by name, highlighting her repeated calls for closure and her boasting about fixing the property value problem. A wave of condemnation targeted her. She remained silent in the HOA's online forum, though I suspected she watched from the shadows. My phone buzzed with neighbors asking if there was a special meeting to address this fiasco. The HOA board, apparently blindsided, scheduled an urgent session the next day. I left the phone calls that night exhausted but determined. If Karen thought she could manipulate local codes to kill the hospital, she'd soon learn the state health commissioner outranked any meddling HOA tyrant. The next day, I arrived early at the community clubhouse for the emergency HOA meeting. A crowd of neighbors had already gathered, many brandishing signs that read, "Hospitals save lives," or "Karen doesn't speak for us." The atmosphere was tense, an unusual scene for a typically sleepy suburban board meeting. Inside, the board members shuffled about, clearly distressed by the swirling chaos. Karen finally entered, wearing a tailored suit and an expression of triumph mixed with unease. She approached the podium, ignoring the angry murmurs. As soon as the meeting started, she tried to present her successful petition that supposedly drove the city to act. She labeled it a major improvement for Brookhaven, claiming that the old hospital was a ticking time bomb of liability. Ms. Whitley stood, her face stormy. "Are you out of your mind? People rely on that hospital." Another board member demanded to know how Karen orchestrated such a quick closure. Karen gave a haughty shrug. "I merely pointed out the truth to city officials, that the building was substandard and depressed local property values. They saw a reason." At that moment, I rose, revealing for the first time at an HOA meeting that I was the state health commissioner. Gasps peppered the room. Some recognized me from news coverage, but many had never realized the quiet woman in the corner held such a powerful position. Karen's eyes widened in shock, and for a flicker of a second, I saw genuine fear. Calmly, I said, Brookhaven General is not substandard. It's a certified facility that meets state licensing requirements. These so-called violations are minor or non-applicable. I intend to have the state override the city's shutdown order. Karen, you have endangered thousands of residents in and around Brookhaven Heights. A hush fell. Then, neighbors erupted in applause and cheers. Karen sputtered, attempting to salvage her stance. But the city found real code breaches. I cut her off, stating that her manipulations would be exposed once the official state inspection was done. The entire room erupted, many shouting at Karen for her arrogance. She shrank back, undone by the magnitude of the backlash. While the HOA meeting concluded in uproar, I rushed to the hospital to greet the state inspection team. A group of structural engineers, building code experts, and medical inspectors arrived from the Capitol, determined to complete a thorough review. Inside, doctors, nurses, and even patients still waiting to be transferred offered tearful welcomes, desperate to see the hospital reopened. For hours, the inspectors combed the facility, checking the roof, the electrical panels, the plumbing, emergency equipment compliance logs. Every corner was scrutinized. Meanwhile, I met with hospital administrators to gather their side of the story. They revealed that city officials had shown up abruptly, brandishing a list of infractions, mostly referencing outdated building standards from decades prior. Stuff any hospital of Brookhaven's vintage might accumulate if not updated, but rarely serious enough to justify closure. The timeline was suspiciously swift, aligning with Karen's relentless push. Late that night, the lead inspector, Ms. Figueroa, briefed me on their preliminary findings. There are a few minor code issues, like a missing exit sign and a hallway that needs better fire insulation. Nothing that demands a full shutdown. Most to be fixed quickly. She indicated that, from a health department standpoint, the hospital was safe and vital. I exhaled relief. We agreed to expedite a formal recommendation to the state that Brookhaven General must be allowed to resume operations with a short grace period to correct the minor infractions. By morning, I'd signed the necessary orders to override the city's closure. The hospital could reopen soon, saving many from lengthy ambulance drives to distant facilities. I left feeling triumphant, but also furious. Karen's petty obsession with property values had nearly caused a public health crisis. If an emergency occurred that week, precious minutes might have spelled life or death for a heart attack or trauma patient. My desire to see her held accountable blazed. But first, we had to get the hospital open. Then the legal repercussions for Karen's actions could follow. Bright and early, I met Ms. Figueroa at the state capitol building. We finalized the inspection report, emphasizing that the closure was unwarranted and threatened public safety. With signatures from relevant officials, we enacted the Emergency Healthcare Infrastructure Preservation Clause, rarely used but designed for precisely this scenario. By midday, the official order was served to the city. They had to lift the suspension on Brookhaven General immediately or face stiff penalties. News cameras caught me outside the hospital that afternoon, announcing that the state recognized Brookhaven General as safe and essential. Applause erupted among staff and gathered residents. Ambulances and staff began returning, and the reeling facility prepared to accept patients again. An outpouring of gratitude flooded my phone and the local social media groups, praising the swift action. Hashtag Brookhaven Hospital reopens soared in local trending topics. Karen, meanwhile, found herself vilified. The public realized she orchestrated the fiasco. She tried issuing a statement claiming concern for safety, but few bought it. Ms. Whitley said the HOA board planned to call a special vote on removing Karen from her position, citing abuse of power and the enormous damage caused. Neighbors demanded she reimburse the hospital for lost revenue and relocation costs, not to mention the stress inflicted on patients. Seeing the tide turn, Karen made desperate attempts to justify her actions. She called an impromptu press conference on her driveway, which only a handful of local reporters attended. She rambled about outdated codes and property values, but the conversation quickly turned to the newly published state inspection, which discredited all her claims. The reporters hammered her with questions about forging or exaggerating evidence. She stammered, pinned in her own web of lies, then stormed off. With the hospital reopened, the immediate crisis abated, but the fallout weighed heavily on Karen. The HOA board scheduled a formal meeting to address her conduct. Days before it, Ms. Whitley confided that Karen had been censured in the past for overstepping, but never to this extreme. Now, the board's email list was flooded with calls to remove her permanently and possibly sue for damages. For me, the matter was both personal and professional. The fiasco nearly jeopardized many lives. As state health commissioner, I was used to tackling bureaucracies, but not sabotage from within a small community. Yet, ironically, living in Brookhaven gave me a vantage point on how harmful a single Karen could be with enough persistence and cunning. She found a crack in the system, complaints about building codes, and exploited it. Marcus reminded me I had the right to attend the special HOA session as a resident. They can't hush you. You're part of this community, and your role is crucial. So I prepared to speak my mind. More than that, I wanted to ensure the board took robust measures to prevent any repeat scenario. Others in the neighborhood also planned to speak, outraged by the near disaster. On the evening of the meeting, the clubhouse was packed. The entire block seemed to show up. The board laid out the official complaint against Karen: misuse of HOA resources to push for closure, falsifying or exaggerating code violations, causing significant damage to the hospital and risking public health. Karen sat near the front, face pallid but chin raised defiantly. People lined up to speak. Ms. Whitley read testimonials from seniors who rely on Brookhaven General. A father recounted how the hospital saved his toddler, who choked last month. Another neighbor declared that Karen's petty obsession almost cost us an essential resource. When my turn came, I introduced myself, no longer hiding my title, and explained how the forced closure was unwarranted and reckless. I concluded with a stark statement. Had there been a critical emergency in the past week, someone could have died for want of immediate care. This was no trivial matter. The crowd nodded, many glaring at Karen. She tried to defend herself, insisting she didn't want to harm anyone, just to improve the neighborhood's image. The board, unimpressed, unanimously voted to remove her from the HOA position. The president announced that the association would disclaim her actions as unauthorized and might consider legal recourse if the hospital or any residents pursued damages. Karen's eyes darted around, searching for allies, but found none. The community that once tolerated her petty rules had finally turned. She left in a fluster, overshadowed by the fury of neighbors she'd alienated. After Karen's ouster, the atmosphere in Brookhaven Heights lightened considerably. The HOA quickly assured the hospital administration they supported a stable relationship going forward. Meanwhile, Brookhaven General resumed full operations, addressing the few minor code updates pointed out by the inspectors. The local press praised the swift state intervention, labeling Karen's campaign a cautionary tale of HOA overreach. But the story wasn't over for Karen. The hospital's legal team considered filing a civil lawsuit for lost revenue during the closure and for defamation. Many neighbors also wanted her to face consequences. However, from my vantage point, I saw that the city, embarrassed by how easily they'd caved to her demands, might also hold her partially liable for misleading them. If she forged documents or misrepresented evidence, that could be grounds for criminal charges. Karen tried to keep a low profile, skipping public events. Some neighbors saw her packing boxes, rumored she might sell her house and leave. She no longer strutted around, measuring lawns or complaining about building color palettes. It was as if the gravity of her misdeed finally sank in. In my conversations with the hospital's leaders, I encouraged them to document the financial and operational harm inflicted. The state could also support them with grants or legal counsel if they pursued restitution. Yet Dr. Lindstrom, the administrator, told me they might focus on rebuilding trust rather than a prolonged court battle. We want to move forward, not get mired in lawsuits, she said. But we'll keep that option open if she tries any further stunts. I understood. My personal stance was to let justice run its course if new evidence emerged, but I had no interest in a vendetta. We'd protected the hospital, and that was the main victory. The next steps were about ensuring no future Karen could replicate such sabotage. Within weeks, the dust settled. The city planning department quietly reversed the closure order, acknowledging insufficient grounds. They faced public criticism for mishandling Karen's complaints without proper scrutiny. A new directive from the mayor's office required more rigorous vetting of requests to shutter essential services. My staff at the health department worked with city officials to tighten protocols, so no single disgruntled resident could spark a closure again. Brookhaven Heights found a renewed sense of unity. Residents who once bickered over trivial matters now recognized the hospital's importance. Some organized fundraisers to modernize certain aspects of Brookhaven General, ensuring it stayed in top shape. The hospital staff, touched by the community support, arranged an open house day, inviting neighbors to tour the facility, meet the medical team, and learn about emergency preparedness. Marcus and I attended, mingling with doctors and fellow neighbors, feeling proud that our new home truly valued public health. People approached me, expressing gratitude. "We had no idea you were the state health commissioner," they said. "Thank you for saving our hospital." I try to be modest, noting that I simply used the authority and resources of my position to rectify an injustice. Really, it was the neighbors' outcry that fueled the movement. I insisted. Meanwhile, Karen's house went on the market. She never again showed up at HOA meetings. A few neighbors said they glimpsed her leaving in her car, looking stressed. Rumors flew about potential lawsuits from the hospital, but in the end, nothing major materialized. The damage to her reputation was punishment enough. Freed from her meddling, the HOA resumed normal community building tasks, organizing potlucks, yard sales, modest landscaping guidelines, but no draconian edicts. As summer approached, Brookhaven Heights thrived. The news cycles moved on, and the fiasco of the hospital closure became local lore. People joked about the time Karen tried to kill the hospital, turning it into a cautionary anecdote about letting one overzealous neighbor disrupt vital services. With the new, more moderate HOA board in place, daily life grew more pleasant. Grass grew a tad taller, mailboxes varied slightly, no one minded. Brookhaven General, buoyed by the supportive wave of activism, upgraded a wing to serve geriatric patients better. They installed new signage and repainted the facade, so, ironically, the building ended up looking fresher than ever, negating Karen's eyesore complaint. The new motto on a banner read, "Here to serve the community, yesterday, today, and tomorrow." Local families felt safer knowing urgent care was just minutes away. At a celebratory block party in June, the neighborhood gathered to toast the hospital's continuing success. The staff from Brookhaven General joined in, setting up a health booth with free blood pressure screenings. Kids ran around with balloons, while parents tasted barbecue. Ms. Whitley gave a short speech, praising the neighbors' unity in defending the hospital. I offered a few words about how we protected a crucial asset from misguided efforts, carefully not naming Karen, though everyone knew the reference. People cheered me on, some chanting, "Thank you, Commissioner." My heart warmed, seeing the synergy of my professional mission, ensuring access to health care, aligned with the personal desire for a safe, vibrant community. This was precisely what I'd hoped for when we moved here. One quiet afternoon, as I was pruning rose bushes in our front yard, a moving truck rumbled up the street, stopping at Karen's house. She emerged, wearing plain clothes and a glum expression, directing movers to load boxes. She caught sight of me, hesitated, then approached. I braced for confrontation. Instead, she gave a small, joyless smile. "Dr. Royce," she said, her voice subdued. "I assume you know I'm leaving. The neighbors made it clear I'm not wanted." I lower my pruning shears. "I'm sorry it ended like this. But your attempt to close the hospital jeopardized a lot of people, Karen." She flinched at the nickname. Then she sighed. I didn't realize it would escalate so severely. I was only trying to... She trailed off, as though grappling with shame. I guess I wanted to make the neighborhood more exclusive, more prestigious. I never intended to truly endanger people. I studied her carefully. Perhaps she felt remorse, or perhaps she was just sorry she got caught. Hospitals aren't about property values, I responded, keeping my tone measured. They're about saving lives. If you truly had concerns, you could have asked for improvements, not try to shut it down. She nodded, eyes downcast. I see that now, she muttered. Anyway, I'm moving out. Good luck with everything. Without waiting for a response, she walked away, shoulders slumped. I felt a pang of pity, yet was overshadowed by relief that her destructive presence would no longer loom over Brookhaven. Some lessons come too late. With Karen gone, the tension that once gripped Brookhaven dissolved. Over time, new families moved in, oblivious to the hospital scandal. They just saw a friendly, well-maintained neighborhood with a reliable healthcare facility close by. The older residents who witnessed the fiasco often recounted how precarious it had been, expressing gratitude for the state's intervention, and a certain resident who happened to be health commissioner. The local press occasionally revisited the story in retrospective pieces, labeling it a landmark example of overreaching HOA activism thwarted by higher public health authorities. I found it surreal that my personal address was part of that narrative. But the coverage died down, replaced by the next big headline. The hospital, for its part, quietly thrived, forging new partnerships with county health agencies. They expanded their pediatric ward, ensuring local children got top-tier care. Marcus and I fully embraced Brookhaven Heights as home, forging deeper bonds with neighbors. We hosted small dinner parties, took part in park cleanups, and even joined a monthly book club. Freed from the shadow of Karen's extremist property value obsession, the community discovered it could flourish while cherishing the essential role of its hospital. Ms. Whitley, who eventually became HOA president, steered the association with empathy and common sense. And though I typically kept my professional life separate, I occasionally gave small talks at local gatherings about the importance of accessible health care. People listened with genuine interest, proud that the state commissioner lived among them. In a sense, Karen's fiasco ironically strengthened the bond between the hospital and the neighborhood. We realized how fragile our safety net could be if no one stood up to protect it. Months later, as I strolled through the hospital halls, invited by Dr. Lindstrom for a quick tour of newly renovated sections, I spotted small tokens of appreciation from the staff. A photo collage of neighbors who'd been saved by Brookhaven General, a plaque acknowledging community champions. Among the names listed was Ms. Whitley, a couple of nurses, Dr. Lindstrom, and me, simply labeled resident and commissioner. It warmed my heart. This was the kind of synergy I'd always dreamed about, a community where healthcare workers, officials, and everyday residents collaborated. The entire fiasco with Karen, though stressful, underscored how easily misinformation or malicious intent could undermine vital services. As we completed the tour, Dr. Lindstrom mentioned how finances had improved thanks to philanthropic donations that poured in after the closure scandal. Sometimes adversity sparks generosity, she mused with a smile. Outside, fresh flowers bloomed along the hospital's entryway, a sign of renewal. I breathed in the crisp air, thinking about how close we'd come to losing this place. Now it stood stronger than ever. The subsequent year brought further developments. The city, humbled by the fiasco, passed new guidelines making it harder for a single individual to push for drastic closures without thorough review. The hospital installed a small urgent care annex, further boosting convenience for local families. The state recognized Brookhaven General with a commendation for excellence in community outreach, an award I presented in an official ceremony, ironically as a neighbor. Brookhaven Heights embraced a new normal. No oppressive HOA rules, no menacing official blocking progress. The board hammered out balanced guidelines that maintained aesthetics while fostering a welcoming vibe. People landscaped with more creative freedom. The dreaded measuring tape that Karen once brandished vanished from sight. Instead, there were volunteer days to plant trees along the main boulevard or paint the local playground. A sense of authentic, neighborly pride replaced the previous forced uniformity. Occasionally, older neighbors would half-joke. "Remember when Karen tried to axe the hospital? Thank goodness Dr. Royce set her straight." I'd laugh politely, though inside I recognized it wasn't a single-person victory. The entire community stood behind the hospital, and the state's authority simply validated that stance. This synergy reaffirmed my belief that while my official position held power, real change came from unified local voices. Late in the summer, a small health fair took place on the hospital grounds. Booths offered free screenings, healthy living tips, and talks by local doctors. Families wandered through, sampling fresh produce from a farmer's market stall. A stage featured short presentations on CPR training, mental health resources, and even a demonstration by paramedics. The crowd glowed with positivity. This was the heart of what community healthcare stands for. I was invited to give the keynote speech, bridging my role as a neighbor and as health commissioner. Stepping onto the stage, I gazed over the audience, mothers with strollers, elderly couples, teens exploring volunteer opportunities. My chest swelled with gratitude. I spoke about how healthcare thrives when communities invest in it, how each of us can safeguard vital services from misguided attempts to dismantle them. Without naming Karen, I alluded to the lesson that convenience or property values can't trump human well-being. Applause resonated across the makeshift auditorium. Dr. Lindstrom handed me a small commemorative plaque in recognition of unwavering dedication to Brookhaven's health. The moment felt surreal, yet deeply affirming. Marcus, beaming in the front row, snapped photos. Neighbors waved, some teary-eyed, remembering the closure fiasco that nearly spelled disaster. Another year sped by. Karen, to no one's surprise, never reappeared in Brookhaven. Rumor had it she moved out of state. A few neighbors whispered she might have faced civil suits from some hospital patients. Regardless, the community rarely spoke her name, content to let the memory fade. We learned from that chapter, forging a future that valued collaboration over confrontation. Brookhaven General continued to flourish. The staff recruited new specialists, reducing the need for residents to trek to big city hospitals. Each day, ambulances responded swiftly to local emergencies, saving precious minutes. The facility's once-dated interior got a modern facelift, courtesy of philanthropic contributions. People took pride in calling it our hospital, not just a building overshadowing property values. As for me, my daily routine mirrored that of any suburban homeowner. I took out the trash, weeded the garden, greeted passing joggers. But occasionally, I'd attend a statewide meeting in the Capitol, discussing hospital policies, or appear on local TV for public health announcements. Whenever I introduced myself as Dr. Alina Royce from Brookhaven Heights, people recognized the synergy between a dedicated official and the vibrant neighborhood she called home. It felt sweetly ironic that a place once threatened by an anti-hospital crusade was now revered for its robust healthcare environment. Today, Brookhaven Heights stands as a testament to how a determined community, fueled by both grassroots unity and supportive policy from higher authorities, can protect what truly matters. The fiasco that erupted when an overzealous HOA member, Karen, tried to shut down the local hospital proved that no single person's misguided agenda can withstand the collective will to preserve vital services. With Karen gone, the HOA thrives under balanced leadership, focusing on genuine neighborhood improvement rather than petty power games. Brookhaven General remains the beating heart of the area, saving lives and offering comfort. The once dull building is now a polished gem, shining with new facilities, funded by community drives and municipal support. The city learned, too, strengthening regulations so that spurious claims cannot uproot essential health care. In the end, the cunning plan to boost property values by eliminating a supposed eyesore backfired spectacularly, culminating in the quick reversal of the hospital closure and the public disgrace of Karen. She hadn't realized her neighbor was the state health commissioner, someone prepared to mobilize official channels, expertise, and moral authority to safeguard the region's health. That oversight sealed her downfall. For me, Dr. Alina Royce, I found a deeper sense of home than I ever anticipated. My mission to protect public health intertwined seamlessly with the day-to-day joys of suburban life. Looking out from my porch at Brookhaven's tree-lined streets, hearing a distant siren that reminded me help was always near, I felt an overwhelming gratitude. The neighborhood overcame adversity, forging a stronger bond with its hospital and each other. A once divisive crusade ended in a unifying victory for compassion and common sense. A happy ending indeed.